Residents of the territory can look forward to the completion of the new Peebles Hospital by the end of September 2013 as government moves ahead with efforts to develop and implement a holistic national health strategy aimed at revolutionizing the Virgin Islands health sector. Minister for Health, Ronnie Skelton, along with project engineer Bennett Smith and quality engineer Dan DeMeyer, gave a progress report on the project during a media tour of the facility on Tuesday, April 23rd. The tour consisted of a walkthrough of the facility and was also joined by representatives from the Ministry of Health and other interest groups. Sean Rose has more.
Construction work on the new Peebles Hospital project is moving along steadily, and the Minister of Health and Social Development, Honorable Ronnie W. Skelton, has expressed his satisfaction with the pace of work thus far. During a media tour today, the minister said that the project is expected to be completed by August 30, but there may be an additional 1 month to allow for the completion of the entire project. He says that there will be a phasing in process in terms of access to the various services here at this new hospital when it is ready for commissioning. The extent of the progress being made on this project that is likely to cost in excess of $100 million is evident in the mechanical reinstallation works, wall finishes, casewalk installation, and plumbing fixture installations that were absent during a media tour conducted in 2012. Close to 180 workers are employed on this project. The 7-floor structure is 151,000 square feet and will accommodate 120 beds and feature 3 operating theaters, 1 procedure room, and 3 labor and delivery rooms.
Station on the 4th floor, or the ground floor, that we haven't gotten to the last time we were here. We have been to the ground floor. We have outpatient reception, general reception, a security area, a gift shop, a pharmacy, catering and dining services, receiving and stores, and a registration. Moving up the second floor, you will find a chapel, which is extremely important in our culture. Administration offices, central sterile supply department, medical records, and physical therapy room. That will be on the second floor of this facility. On the 3rd floor, we have radiology, as we just came from. We have medical and surgical wards and psychiatric ward, which we have just seen. We have operating theaters, recovery room, endoscopy unit, critical care unit, neonatal unit, labor delivery rooms, and obstetrics. On the 5th floor, which we are on now, we have the pediatric ward, medical and surgical wards, and there is space, as I show you, for future expansion. So we're building 120 beds now, and we can expand it to more beds.
According to the minister, an operational plan including a staffing strategy, clinical services plan, and the comprehensive medical services plan are already completed.
Requests for proposals are being prepared for data, CCTV security, and access control systems. The final furniture selections have been made and the final specifications received and accepted by the Health Services Authority. Reconfiguration plans for the old Peebles Hospital and Annex are in developmental process. So when we say that, we mean that we are hoping to use the whole hospital for the Rotan Clinic or even for other clinical services. All general waste will be managed with a compactor, and a team is already researching an autoclave for treatment of biomedical waste.
CEO of the BVI Health Services Authority, Carleen Carty-Baptiste, says the phasing-in process will rely on the availability of trained personnel to provide the services at the new hospital.
Specific to not going beyond our current capacity, maybe 10%. So we may be looking at somewhere from increasing from a 40-50 bed up to 60 to 75 within the first year and a half, giving us the opportunity to train up existing staff in the specialty services while looking at those persons who've been trained by government. We have a meeting with the Minister of Education next week, specifically going going to him and targeting those persons who've been trained with those specialty services that we need to retain them back or get them trained up through attachments elsewhere for the opening.
Meanwhile, the Minister of Health says government is pursuing a national health strategy that is focused on preventative care to reduce the need for and the cost of healthcare services for residents.
That includes strategy for prevention of chronic diseases, that include healthy public policy across all sectors, such as education, agriculture, infrastructure, and sports. Partnering with business and community-based organizations to promote proper nutrition, physical fitness, and preventive care, and empowering communities and individuals to make healthy lifestyle choices and to take responsibility for their health. A social marketing plan that will assist with meaningful and sustainable lifestyle change for the implementation of a national strategy for the prevention of chronic diseases are in process. A National Food and Nutrition Council to act as a national advisory body on food and nutrition matters, including developing and revising national food and nutrition policies and plans ongoing in the Ministry of Health.
Government is also seeking to embark on a medical tourism initiative using the now vacant 6th floor of the 7th floor structure.
And we are talking about basically medical tourism. And we are talking to HEMA hospital system. The Cleveland Clinic has contacted us, so we're going to be exploring those possibilities for the 6th floor.
Based on this media tour, it is safe to say that the Virgin Islands public can look forward to benefiting from the various services to be offered here at this new Peebles Hospital when the building is commissioned. Sean Rose, JTV News.